Welcome to the Chamber Neighbors Podcast, a show highlighting Chapin's community and commerce. Now here's your hosts, Greater Chapin Chamber of Commerce President and CEO Paul Sadler, and Chapin Neighbors Magazine's Daniel Rendelman.
This is Daniel with the Chapin Neighbors Magazine.
And I'm Paul Sadler with the Greater Chapin Chamber of Commerce.
And Paul, tell us, who are we sitting down with today?
Daniel, we have a treat.
You know, I thought you might say that.
We do. Today we have Dr. Crystal Knight with Forget Me Not, dog and cat euthanasia at home.
Oh my, this is going to be an interesting conversation.
It is going to be an interesting one, Daniel, but Dr. Knight, we are so happy that you are here. Thanks for joining us.
Yes. So, doctors, first of all, it's Forget Me Not.
Mm-hmm. Forget Me Not.
Is that like a flower?
It is.
Okay.
It is.
Oh, it is a flower.
Yeah.
Yes.
And it fits for your
Played
business.
right into that because
Plays right in, right?
Yeah, flowers are one of my favorite things to kind of play around with.
Okay.
So
I saw
where the
it
name came from.
on maybe your
Makes
website or logo
sense.
or so, but Forget Me Not, it's not just about flowers though.
No.
You
That's
do
Pet in-home euthanasia.
in-home euthanasia. Yes, listeners, we are putting those words together.
Yes.
This is a thing.
This is a thing.
And when I found out about it, I said yes.
Mhm.
I'm like, this is something I need to plan, prepare for our pups. So first of all, why don't we get started? Tell us about your business and what do you do specifically?
So I offer compassionate pet services in-home, primarily servicing dogs and cats, but I have done the occasional unique creature. But what I do is I come to the client's home and help them with their pet's passing so that they are in a more relaxed environment for both the clients and the pets and try to make a very difficult situation as not easy, but easy as possible.
As easy as possible.
Yeah.
I can't imagine how difficult that must be for a pet parent to call you, but for
Yes.
you to make it as easy as possible, so where that I guess the pet isn't anxious and
Correct.
the human isn't anxious.
Mhm.
That's got to take some skill and I guess some emotional blocking from you as well, right?
Sure. Yeah, it is something that I think different people are going to find their places in veterinary medicine,
Mhm.
just like they do in human medicine.
Sure.
And just like in hospice care for humans, that's really becoming a thing for
Mhm.
our pets as well. So
And you mentioned that so you are a doctor. So
Correct.
you
Veterinarian,
are a
that's
full
right.
veterinarian.
that's correct.
So tell us a little bit about your background. So when folks, if they do need your services,
Mhm.
Hmm.
that, it's not just an assistant or someone coming in to help
Right.
them. You are a veterinarian doctor.
Right. I actually began working in the veterinary field when I was in 10th grade here in Irmo. So I've been in the Midlands for a long time. I went to Clemson for undergrad and UGA for vet school, which is a 4-year degree. So a
Those are-
total of 8 years of
Those
school.
are the Midland's two favorite
Right?
schools, my friend.
Right?
Yeah, no,
So,
that's
and I'm
right.
married to Gamecock. So
Oh,
Uh-huh.
my.
yeah, we're very house divided. But so I went to vet school and started working in the year 2000. So I have been around for 25 years as a clinical practitioner. I worked in hospitals. I've done a little bit of spay-neuter work for the Humane Society and volunteered with some organizations as well. So definitely have some experience there.
Can you walk us through what that process, not the actual process, but the process from like the time that I give you a phone call
Right.
until the end?
Mhm.
Can you walk us through that and kind of tell us what that is?
And you've got to these are questions you probably answer all the time.
Mhm.
Like people
Mhm.
want to know,
Yeah.
how does this go?
I
What
wanna
are the
know.
conversations about? What's happening?
Right.
Mhm.
And that gives a lot of peace of mind.
Mhm.
So yes, I'm interested here.
So oftentimes I get referrals from clients by their veterinarian who know that I offer this service or if they are interested in it. Sometimes clients are not aware about it, and so they do stumble across me sometimes when they're doing internet searches. So they will reach out to me. I have contact information stuff on my website. And they may text is probably the easiest way to get in touch with me. But sometimes I'm in appointments and can't answer my phone, and it's just me. I don't have an answering service, so this is all very local. When people reach out, they may have questions that if they're not covered on my website, then I will speak with them about it. But most of the time, I try to get them a time frame for when they're wanting to do that, and working with schedules.
Okay.
And then really, most of it is handled at the actual appointment itself, unless somebody has direct questions for me.
So is it just homes? You go to like barns or things, or is it?
I don't do large animal currently. I have done a goat, but it is not something that is as common. But usually it's clients' homes.
Okay.
And so we're
So you'll come into
arranging
Paul's
that.
home.
Mhm.
Wait.
Uh-oh.
Let's not make this too
Yeah,
personal.
personal. Yes, I actually
I might cry.
come to their home.
Okay.
I actually come to their home, and clients can choose where they want. If it wants to be outside in the backyard, as long as the weather is okay, then we're good with that. Wherever the pet is comfortable.
Okay.
I've been in some unique situations, but it's certainly at that point where I start talking to them about what I do. And the goal for that is for the pet to experience as little stress and anxiety as possible and no pain. And so it's usually a 2 to 3 step process with uh, sedation first. That's usually given like a vaccine would be up
Okay.
underneath the skin. Most animals don't react to it.
Mhm.
Occasionally, you'll have patients that are super painful already, and they may be reactive, just like some dogs are with vaccines, cats too. So the sedation is to bring them to a point really where they're unconscious and not aware of anything else going on, that I could even do minor surgery if I had to. And it takes about anywhere from 3 to 5 minutes or so for that to take effect. And so it gives people a little bit of a transition period, to allow them to accept that, okay, the patient's just falling asleep. So that's what we're looking for.
So it starts with the sedation,
Mhm.
and then there's another drug
Correct.
administered.
There's
so.
another drug administered that basically is a super heavy overdose of an anesthetic that tells the brain to go so deeply asleep that it forgets to tell the rest of the body what to do.
Wow.
So, yeah. So
Okay.
really it just slows down the
Then-
breathing and the heart.
Then the Rainbow Bridge.
That's correct. Yep.
So how long is that process from the time that you administer the sedative, excuse me, and then to the that passing, like Daniel said, across that rainbow
Sure.
bridge?
Say on average, it's probably about 10 to 15 minutes overall. Some go a little slower. Every patient is an individual. Sometimes what works for one patient may not be enough sedative, and I might have to give a little bit extra. Everyone's a different reaction,
Different.
but usually, I would say from the time of the sedation kicking in, most of the time it's within about 5 to 10 minutes after that, based on family, how ready they are, and the readiness for the patient themselves.
So I've got 2 kids.
Mhm.
This is
Now
only for pets.
this is thanks for lighting the mood there, buddy. Good one.
Okay.
Are kids allowed? Should they watch?
Mhm.
Do we invite them in?
Yes.
Like,
So that's a good question. I get this for not only kids of the family, but other pet members of the family too.
Okay.
I am always welcome to have anyone there. My recommendation for people is if you feel like this will take away from your experience and focus on your pet, then you may want to make other arrangements.
Okay.
Not every pet, not every child is going to be calm in that situation. And what we really want is a calm, quiet environment for this pet. But as far as ages and how they accept, honestly, kids are more resilient than we give them credit for in dealing with death a lot of times. But everybody knows their own individual children best, so I always leave it up to the family, but I don't turn them away. And I'm happy to talk to them. I'm not afraid of telling them what's happening. I always stress to parents, do not tell them that you're putting your pet to sleep. Because there are children who will then become afraid to go to sleep because they don't want to wake up
Yeah.
the next time.
Right.
So always use very clear language with children. Your pet is going to be dying. Okay. Make
That's
it
a
really
tough
clear and don't
conversation.
use these
Mhm.
words that they
Right.
don't understand.
Very
So,
cryptic and
yeah.
But what I'm hearing as well is this is also such compassionate care
Mhm.
because it's not taking a pet to a a veterinary hospital on this cold table or slab and just doing the deed. There's no Sarah McLachlan singing "Arms of an Angel." This is so much better.
There's Little League competition for baseball on the TV screen in the
Right.
background.
You go to
Uh-huh.
vets
Yeah.
and I feel horrible for those vets because at one moment they're seeing a puppy
Right.
and they're loving on this puppy, and then they're seeing a cat that's, you're having a normal bad day, and then they have to go euthanize, and then they have to go to another patient.
Correct.
So you're able to come in directly and to be able to do this. Why is my question? Why did you
Why
choose
did I
this?
choose it?
Yeah.
Mm.
I think part of that, what you just touched on, is really being able to provide my own pets the gift of having a euthanasia done at home. It's an experience that is much more. It's much more soothing for everybody. I oftentimes face that with clients at the clinic themselves, and a lot of clinics are doing their best in that they have formed what we call comfort rooms, where it's not an exam room. It's made to look more like a room in a home where there's sofas or rugs or blankets and things like that. So it's not as cold.
Right.
And they're doing their best to make, because we all end up there at some point with a pet. Sometimes emergencies are going to happen. But why I did it was a gift for the families that are there. And there's some personal reasons too. It allows me a little bit more flexibility with my family, and being able to coordinate schedules a little bit easier too.
Yeah.
Mm-hmm.
That's great. That's a great why. Let's go back for a second if we can. So, as Daniel said, once the deed is done, then what?
Yeah.
Like
Then
what
Yes.
happens after that? Like directly after that, what do we do? What are you telling a family to do?
So oftentimes before the appointment, we are already deciding on what's happening next.
Okay.
Families are encouraged to make a decision what they want to do. Some choose burial at home, which in some cases may be easier than others. I've had patients that wanted to bury, a Saint Bernard. That's a much bigger project than a small Chihuahua. You also have to take into consideration: are you allowed to bury the pet at home? Town ordinances, things like that can be an issue, and the medications that are oftentimes used can be dangerous for wildlife, and so you have to take some precautions and where you're burying and how you're burying. And I usually provide some guidelines for that, for owners that choose that. If they don't, then we're making a decision generally for either cremation or a process called aquamation. Cremation is a traditional, using the fire, and aquamation is a newer process that's coming about using water and some natural chemicals that are at play for helping with the process. And that facility right now, there's only 2 in the state. One, I think. There could be more, but there's not anybody here locally in Columbia in the Midlands area.
But for the cremation and those services,
Correct.
you have referrals, you work with
Right.
those businesses
Right.
and are able to help the families make it as
Yes.
as
And
easy
so
as possible.
And usually there will be somebody to assist with transportation, should it be required.
And I know that this isn't a sales pitch, but when I found out her price, I was very surprised how affordable this was to help your fur baby at home. And I know that that's listed on your website, which we
Right.
will put in the comments so people could learn more and
Sure.
see that happens to be there. There's got to be a lot of misunderstandings too about this. I know you mentioned to me once, you at times you can hold the pet or the family can hold the pet,
Right.
and it's this isn't a cold interaction. It's a very loving, kind, compassionate thing. Any myths that kind of you think of that
I
come to
think
mind?
a lot of people struggle with the want for their animal to pass naturally at home and to pass in their sleep. And that just is not something that we see. It's not even common for the human side for someone just to go to sleep and not wake up. There's usually a lot of trauma involved with that. And so what I tell people is like, we're really inducing sleep. So your pet is passing in sleep. And so it helps bring a little bit more comfort there. We don't let Mother Nature take its course anymore for animals when we bring them into their home and have them as loving pets. And so we kind of have to be that decision maker for them sometimes. So, yeah.
Is there anything that you would like our listeners to know a little bit more about what you do or anything like that?
I think that the biggest thing that I get is when you have an animal that is of a senior age, it really is something to try to start planning a little bit for in advance if you can. Not every situation is like that, but given the way that things are set up, because I'm coming to your home, I'm not always available in an emergency. And that can be frustrating for some clients.
Sure.
While we do our best to do same day appointments, if I already have appointments scheduled, then it makes it more difficult. That's probably the biggest thing is going ahead and having a plan in place. If you know your animal is not doing well, go ahead and reach out sooner rather than later.
Okay.
Yeah.
Like my 18-year-old
Yes.
Linus,
Yeah.
we just been expecting this.
Yeah.
We need to prepare.
It's like you'd have a pre-need
Right.
for your dog, basically.
And that when it happens, you can have these conversations beforehand,
Right.
which I think is
Right.
just fascinating.
So where are you servicing? You're here in the Midlands. You're
Correct.
here locally. So is it just the Yermo Chapin area, or do we branch out a little bit?
Try to stay within about a 30-minute drive. I'm
Okay.
based out of my home, so I
Okay,
don't
yeah.
have a brick and mortar office.
Right.
So I try to stay about a 30-minute drive from Irmo, but I will travel a little further if time allows, and
Okay.
there's a little bit of an additional travel fee
Sure,
for that.
yeah.
It's pretty much anywhere in Columbia.
And you
So,
mentioned same day appointments if you're available.
Mhm.
So I mean, we
Yes.
can call you and say, hey, this is
Yeah.
it, and
Right. And I
Yeah.
will do my best in a lot of situations, or if I'm unable to, I will try to get you where you need to go.
Okay.
If your veterinarian office is closed, there are urgent care facilities that are available that really do a good job in trying to provide, like I said, those comfort rooms and a more not pleasing experience, but yes, not a cold,
Is there
sterile
something
room.
you maybe you wish people knew about this? I mean, first of all, we wish they knew about it. That's just first of all,
Yes.
just the awareness of the service when we think about it, and wow, how blessed we are as a community and nation and people that we could have the service.
Right. Right.
And then considering just the awareness of this is an option. I didn't know this was an option until just a few weeks ago. I'm like, wow, we have to be thinking about
Right.
this. But is there anything else besides the awareness of what you do that would be good for people to know?
I think it's just the fact that when you're trying to make plans, reach out to your family members, discuss the options that you want to provide for your pet. How do you want to take care of the remains? People think they want to bury at home, and sometimes that's a lot harder, and it's very difficult to make that decision on a short notice basis. But just trying to get the word out, share with your friends. Most vet clinics in the area know that I'm available, but sometimes it's a little too late when the animal's already in the office and very ill, whether or not they can make that decision or not. So,
Well, thank you for providing pets a peaceful and comfortable experience at home.
Yeah.
Yep.
Yeah.
Very nice.
That's
Very
awesome.
nice, Dr. Knight. We'll put your contact information in the comments here. Anything else before we finish up?
No, I'd really just thank you for giving me the opportunity to speak about this. I'm encouraging other
Great
people to
stuff.
find out about it.
Yep, great stuff.
Absolutely.
Thank you, Dr. Knight.
Thanks for
Thank
being
you.
here. And listeners, if you have a suggestion for a guest to be on our podcast, please reach out to Paul at thechapinChamber.com. Thanks again for listening to this edition of The Chamber Neighbors.
This has been the Chapin Neighbors Podcast, where we highlight all that makes our community special. We hope you enjoyed our time together. Please like, subscribe, and share the Chapin Chamber Neighbors Podcast.